Welcome to MAP, the bi-weekly market access podcast hosted by me, Dr. Stefan Walzer. I am the innovator of Market Access 4.0 and a health economist by training and working in the fields of market access, reimbursement, pricing, and health economics since 2004. Discover Market Access 4.0 and unveil the future with our innovative solutions. Max Insights, our fast and easy AI-based reimbursement planning platform. Dobo, our new revolutionizing way of creating reimbursement dossiers across the globe with the first and only dossier writing AI bot. Cubo, our new AI-based objection handling platform. And Waffle, train with Waffle's virtual reality genius in an immersive environment and with an AI-based counterpart. We are Market Access 4.0. So check out our website, marketaccess4-0.com. And now let's dive into the current discussions, processes, and trends in market access across the globe. Welcome to the next episode of the Market Access podcast. Today I have a very special guest, I would say. I have Hatice Küçük Beton. And Hatice is especially working since quite some years as an executive director for the G20 Health and Development Partnerships. And of course, just with that title, we can probably already thinking about different kind of discussions we could have for probably not only minutes, but probably hours. So welcome, Hatice. Great to have you.
Thank you, Stefan. It's a real pleasure to be here with you today. And yeah, as you outlined, I was just reflecting over it. It's been actually a decade since I've been in global health and multilateralism around global health. So a lot has happened in the next 10 years. I think that's what we will cover today as well. So looking forward to the discussion.
Yeah, also, and I mean, you brought it already kind of up there, right? I mean, you cover now already a couple of years that kind of, let's say, sphere, right? I mean, and if we maybe have a look, I mean, what you could name as kind of global health within the geopolitics, I mean, maybe we can just start with that. What has mainly changed in the last roughly 10 years? Maybe take around 2015 as a kind of, let's say, time point. Maybe especially also in the context of G7 and G20. And what was, if there was any, but I would assume there was at least one, what was the key turning point from your perspective?
Yeah, definitely. So I must say, just as a disclaimer at the start, I basically fell into the global health space. I literally have an economic background, and I've been doing foreign policy before, and I had a passion for multilateralism, and global health was never on my radar, to be honest with you, until I fell into the space with Germany onboarding the G20 presidency in 2017. Back then, the concept of global health for me, as an outsider from the sector, was more linked to overseas development aid and basically a social policy matter. And it had so many different fragmented facets that I couldn't really capture the framework and how it basically benefits our economies, or even how it strengthens, ties between nations. And I was not aware how big of a soft diplomacy tool global health could be. So that's as a disclaimer, because I'm not a health specialist. But what I found remarkable is when we were asked by the German government in 2016, back then led by Angela Merkel, our chancellor, to whether we could, create a group that could look into breaking silos in global health and to make a joint pledge to G20 health and finance ministers of how we can tackle future threats in global health. We started basically looking into all the cross-cutting health silos and diseases. And what was remarkable at the time was, which I think features until today, is that there was always a gap in investing into innovation and R&D. And at the time, if you look into how basically it shifted over the time we embedded this in the G20 agenda, 2017 G20 leaders or health ministers had a first simulation exercise on how to tackle a future pandemic threat, which was quite exciting because back then there was no pandemic yet. And of course, 3 years after, we actually have faced the pandemic, unfortunately. But even then, I think when I reflect back, health was directly linked to a financial decision, how it can basically build strong economies and societies, but also actually a security matter. Because when you reflect on the discussions health ministers had at the time, it was a national security matter. And if you look at the discussions we see on TV in the last few weeks and recently, it's again in that whole framework. So in a way, the importance of health, thankfully, was seen on the G20 agenda in 2017. The turning point happened throughout the pandemic, unfortunately. So G20 health ministers were discussing the leading cause of antimicrobial resistance, that it will likely kill more people than from cancer by 2030. These discussions happened already in 2017. As I said, how we can tackle a future pandemic, how we can strengthen our surveillance systems through better data management. These were all items on the agenda. But what really triggered the change in global health for me and what I observed was, for the first time, the Japanese presidency that we collaborated with as well, 2019, for the first time, they brought together health and finance ministers to discuss the future of universal health coverage financing, because there was already, forecasts have shown there will be a budget gap in the years to come. And that was a very tangible conversation. And a year after, or a few months after, of course, the pandemic hit. And all of a sudden, health that used to be a sideline topic in the G20, not much of a key focus for leaders, has become the pivotal moment around the world, because over 13.8 trillion it has cost our economies, if not even more, right? These are some statistics from the World Bank. And this was the time where people realized that it actually affects economies, education, all aspects of life, where we took it more seriously. And that was also the time where investors have seen health or investment into health in a different light. And there was obviously different investments have spiked in the 2 years after the pandemic, and equity has flown into healthcare. But then, to your point, if you reflect now in the last 24 months, there's a dip again in health. It has gone that far that between 2020 and 2022, there was a drop in health spending, especially in 18 out of the 20 G20 economies. And that shows again that when there was a crisis, it was seen as a pivotal item that can threaten economies and societies. But then people forget, right? It's like with election promises, people forget. And we're back to, we have learned a lot. We have broken silos. The whole community has shown what they can do in a short amount of time, especially with the development of the vaccine. But I fear, from what I observe in the last few weeks, that we have forgotten about what we have achieved, and we're falling back to our traditional silos and comfort zones. And we can't afford it no longer. So it requires a new way of thinking and communicating global health, in my view, for the next few years to come. But I'm guessing we will discuss that as well.
I think this is giving a really interesting kind of frame, also what happened in the last, roughly 10 years. For me, a key question is basically, what we all know is what you just said as well. People, whoever that is, layperson, decision makers, experts, whoever, tend to forget, of course. And that's clear. That's what we know as well from different science, whatever. I'm totally with you. Of course, it's a kind of explainable, as there was an immediate threat with COVID and everything. I think all of the moves came in there, etc. But what was really interesting was rather, you just said as well in 2017. So it was roughly 2.5, 3 years before the COVID pandemic basically hit all of us. There was also a simulation exercise for a pandemic threat. Of course, let's say health experts knew that this could happen with a given likelihood, blah, blah, blah. But the interesting thing is rather that you just said it was somehow as well on the agenda, maybe not absolutely highest level, but Could you explain how that basically got on that agenda? And is that maybe something we could also take as a kind of learning, especially in the situation we're currently in, which is also maybe a bit of a difference to 2017. As far as I remember, there was no kind of economic downturn, a lot of uncertainty in the world for whatever reasons, what we're currently in. So is there anything what we can maybe take up as a learning to bring health again back a bit, at least closer to a priority on all of our agendas?
Yeah, it's an interesting question. I mean, if I think back, first of all, it requires a leader. I would say, let's start with that. You need a leader in global health at the highest political level who really puts their head forward and their thoughts. And for me, that was clearly Angela Merkel at the time, right? She not only championed the migration issue, of course, which had ups and downs, which is a matter for another podcast and discussion, but also in global health, she took the leadership to place it on a G20 agenda. And G20 is an economic bloc. Yeah. It was classic economic discussions that were going through the G20. So she added this new dimension. I think as a physician herself, she could foresee, the challenges that will basically come upon us in our health systems, which is why she wanted to start these discussions early on. So to your point, I think to answer, you need a political leader and ownership to bring it back on the agenda. Second, of course, is the Global Pandemic Preparedness and Monitoring Board, which existed back at the time at the WHO, which is this quasi, agency that linked to the WHO. They were monitoring basically that a pandemic threat may emerge from their reports. And if you, I think, look at the speech from Dr. Tedros in 2017, he actually mentioned that at the Leaders Summit as well, that the next pandemic is not too long to come. So they were all indicators were there. Science was basically forecasting it, and a global leader took it up and basically promoted it higher on the agenda. And what was remarkable is that it was on an economic setting. We didn't discuss it at the World Health Assembly only, which is obviously the wedding for all the health community. And that was remarkable, how you can link health to security, defense, finance, and trade-related matters. And I think it requires a new type of leadership to have this future outlook again and link it with across the sectors, because no longer, and we saw this during the pandemic, I touched on it, we can see health as health is a human right, of course, but health is not just a health issue. Health, is the issue for employment ministers, is an issue for education ministers, it's an issue for agriculture or, environment ministers. So in a way, we are all linked. And this is what South Africa outlined in their comparative view at their G20 last year. They called for a better collaboration between all the different ministries to basically foresee health threats coming and how it will impact the economies, so they can have a more strategic way of spending into direct or indirect health outcomes. And I don't know if it answered your question really, but I think that's really what's needed.
And I think you probably answered already with your very first, let's say, sentence, right? A leader is needed. Because ultimately you need somebody bringing it up on the agenda, somebody pushing for it, somebody pushing the agenda to discuss it. Because I think that's, of course, a very important one. And I think also what you mentioned as well, link it to defense, trade, etc., which, of course, we are living in a different world than in 2017 or 2015, whatever. But still, I think if you take health not just as either a kind of budget item or just as health as it is, but the impact it might have, and you just brought up a couple of different, let's say, impact, I think this is, of course, a very important point. I just want to as well come back very quickly, because you also mentioned, of course, now, I think the ministers from South Africa brought it up that a better collaboration between ministers is needed. Fully agree. But I think also beforehand you said in 2019, I think the Japanese basically brought it up as well, that I think if I took it correctly, that the finance minister was suddenly as well on board. And I think those are, of course, I would guess from a political perspective, of course, at least if not the very important position in terms of collaboration, especially when it comes to budget. Anything where we could, again, maybe take a learning from there, besides, of course, that if you have a senior leader taking the responsibility, that all of that might get a bit easier. Anything further we could maybe learn, especially after you also just said that at least some countries see and have that on the agenda?
Yeah, I think what was remarkable, the late Prime Minister Shinzo Abe in 2019 basically called for this joint meeting. And for us from the outside, not working within governments, we may think that health and finance ministries, they all collaborate well with each other and they understand each other's languages. Yeah. And little did I know, or that health and finance ministers, yes, they are given budgets by the finance ministry and they decide how to spend it based on their evidence and what's needed in the country. But little do people talk about that the people who administer and manage the budgets in the health ministry don't sometimes even know how to talk to the finance ministry or what the priorities and challenges of a finance ministry are. So the talk of the finance jargon seemed like it's missing in some of the health ministries. So what that made us think is, okay, we need economists in the health ministry as well. That, I mean, there are health economists there, but those economists that understand how to reprioritize financing for healthcare by talking more strategically with finance ministries. And that is something that is still missing until to this date. And from the 2019 meeting where, they came together for the first time, later on, they created the Joint Health and Finance Task Force throughout Indonesia and Italy in those presidencies. And that task force was literally civil servants from both ministries sitting together to discuss how to, identify future vulnerabilities, how to finance it, how to prioritize financing for healthcare. And that type of strategic dialogue didn't seem to exist before. And this is also what I can say off the record. A lot of, not off the record for the postcard, but in off the record conversations, what health ministry colleagues and finance ministry colleagues in the G20 basically emphasized. They said, we didn't know how to speak to them or how to read the data. Now there's a different type of dynamic, how we collaborate with each other. And that's a small thing, not spoken about much, but it can actually change a lot.
Yeah.
Speaking the same language is, I think, the key. And we don't need to invest the millions always, right? It's not about that, but just understanding the gaps and how to navigate them.
Yeah, exactly. Yeah, I mean, it just reminds me, in my very early days in the industry, somebody was as well telling us before an actual negotiation that just understand what the other side needs. Yeah. It's fine if you have, of course, your position and this is important and so on, but you need to understand how the others tick, how they speak, and also what they need. I mean, it's not that you need to agree, but in order to find an agreement between the two parties, and this is even more complex, right? I mean, you need to, of course, also speak the same language. So I think this is a very, very important point. Maybe moving a bit, I take the language kind of thing maybe as well a bit further. I mean, just imagine that we might have a strong leadership, let's say, by whoever. If we are coming a bit into, let's say, a health investment framework in practice, how should and would that potentially look like in an ideal perspective? Taking all what we have just heard about the issues, complexities, and so on, just maybe focusing rather a bit on the framework before we maybe then as well as a second step, not maybe in the same discussion now, maybe then as well move a bit further, what that would basically mean in order to come there. So how would such a framework look like?
Yeah. So maybe a step ahead of that, right? Before that, we, as you know, we created this report on suggesting a health investment framework, and we are further developing it throughout this year. But what's important to note a step before that is that we live at in a time where we can't use certain words when it comes to sustainability, impact, and all these kind of jargons. But also, we live in a time where we don't have the comfort to create new standards, right? And especially the investment community, they don't want to abide again by new kind of reporting standards that may limit them and may add more bureaucracy to their work, especially nowadays where budgets are tight. However, again, how an health investment framework may work, the way how we thought about this when creating it is, how can we create it so there's not a duplication of efforts and we learn from already existing frameworks? So the Green Taxonomy of the European Union, launched a few years ago, provides an excellent framework, and it has worked for investors to redirect their investments into green finance. However, there is also the social taxonomy that the European Union was working on, but never really got to launch, that not many people know about. But even the social investment framework has health components within that. So how a health investment framework would work is, number one, by creating basically positive qualifiers, principles, that define what can work in form of an investment into health. We then have to develop benchmarks, or what we're suggesting are benchmarks, that help to establish a minimum standard required to qualify as a sustainable health investment. But they have to be time-limited benchmarks, of course, in order to show impact. And then the third layer of a health investment framework is to basically set conditions, so to speak, to say what are disqualifiers, what are actually harmful investments or that look like health investments but actually could be harmful. And if you have a three-layered approach by developing positive qualifiers, thresholds, and disqualifiers, you create a common language between investors, companies, and governments to basically redirect the strategic health investments. But what's important to note as a disclaimer here is, in order to use such a health investment framework, you have to first know what the gaps are in your health systems. So which areas do you invest most in? What is the return on value on investment? What areas are underinvested? So you need to have a health impact assessment in your own health economy, so you know how your health economy contributes to the economy, and then work on these gaps. And these gaps then basically are being filled by a health investment framework that incentivizes investments into these areas, if it makes sense.
Absolutely. I think that makes a lot of sense. Absolutely. I mean, I think also the kind of, let's say, of course, speaking the same language, I think the taxonomy, I think that makes a lot of sense. I think also the kind of, let's say, three criteria, I think that's quite clear. Gaps identification, etc. I think the frame makes a lot of sense to me. I think maybe we're trying to go back now again on the political level, which is the potential implementation, right? And I mean, currently, and you mentioned that already as well a bit earlier, we have, let's say, of course, competing interests. And the competing interests are maybe even more complex than, I don't want to say ever, but at least in the last 10 years. I mean, with all of the defense, security, we're discussing about education you brought in there. I fully agree. Climate is still on the agenda, of course, and needs to be there. But also, for example, digital infrastructure. I mean, so a lot of different gaps overall, if you take a system. So how could such a kind of new framework basically be further implemented? Besides, of course, that you need the leadership. But what are your thoughts on that? How could such an implementation really work?
Yeah, I think from obviously having interviewed around like 30 people from the investment community, what I can say is what they said is, number one, if we are developing a health investment framework, either as an own standing item or integrated into a different taxonomy, it has to be market driven. So it can't be only set by governments and imposed on the industry or on investors. It has to basically move on the pace and wishes and demands also by investors. And once it's market led, and governments understand that, there's a new, better way of collaborating with governments to work towards these gaps. And because investors feel like if it's too determined by governments and they're not being given the incentives, it basically, even the framework won't change anything. So A, it has to be market driven. B, they said it has to also, like, in addition to a framework, governments have to understand that they need to ease regulatory requirements, incentivize us to invest in X country, or give us guarantees, because it's not always safe to invest in certain countries. And once these frameworks are given, and organizations like the World Bank act as guarantors or endorsers or validators of such a framework, they would feel much more comfortable to basically use the framework and use that as a tool to invest. But it's very important here that multilateral development banks generally play a critical role, because many investors said if this framework is validated technically by an organization like the World Health Organization, by the OECD, but also by the World Bank and relevant multilateral banks, they feel confident to use it to incentivize, for example, asset managers to incentivize their own investors to use these standards when foreseeing new investments.
Yeah, I think that makes a lot of sense. I mean, especially, you just said it early on, and I think that's very important as well to understand. I mean, the market should drive it, because otherwise, I think acceptability is, of course, as well difficult, especially, let's say, if we're speaking about investors. I think also important, and we know that, I think, is the overall frame. And I mean, if I'm talking about frames, I'm rather thinking about, let's say, the market frames, which in this case maybe as well the kind of guarantees, right? Because otherwise it's very difficult to incentivize as well for real investments.
Exactly. And one point to that as well is what investors also said is, look, we understand that, certain gaps in healthcare systems have to be filled, but also governments have to understand it's not an ODA for us. This is our business as well. And it's not a bad thing. Like when we work in different industries, agriculture, environment, or, classic retail, we never question it that people get a return from it, right? But when it comes to healthcare, and you work in this space a lot, there is always this feeling that, the health industry has to do this for good. Of course, it impacts people. There is a social good component. It's important. But in the end of the day, there has to be a return. And I don't know why it's always a taboo topic, and how it's always been polarized in political debates for so many years and centuries. But if you incentivize an investor to actually co-invest into something, and it helps you, and they generate some returns, what is the downside of this? And I think this is one of the critical things that we need to basically rework in the public sector to rethink, because pharma, yes, there are bad things happening too, but actually it's their business and they're driving a lot of good. So rather than not speaking to them, it's better to speak to them and to investors to drive future investments. We're not talking about privatization of healthcare. That's also a danger in itself, can be abused. But a health investment framework could actually maybe prevent abusement and misuse, right? By setting these disqualifiers. So in a way, it's a new rethink how you work together between industry, investor and government. And it's not bad if they have a return from it as well. And I think that's what it comes down to, because no one questions it in other sectors.
Yeah, exactly. And everybody might anyway go back and just see, how much their own investments, whether that's ETFs or whatever, basically make every year, right? Which is sometimes, that kind of controversial. I think, but we all do the same thing. So why is it not as well acceptable in that area? And as you said, it's a question whether you'd want to privatize a market, which I think in health, we have seen a lot of analysis that this is not working because market is just failing there. But I think the overall, let's say, way how to invest and to incentivize, this is another piece of the same cake at the end of the day.
Yeah, I mean, one of the interviews told me, for example, in France, even if you attract private investments into, let's say, a hospital project, there are certain standards set by the state that you have to abide by as an investor, which are not limiting, but they can be, it's just like certain frameworks that you have to abide by, and that still incentivizes you to invest. So I think this is where governments have to really rethink how they speak to investors and how they benefit their societies and drive value for the long term. Because for a matter of fact, I mean, we have countries, over 69 countries are in a spending stagnation. Global public debt will hit 100% of GDP in 3 years' time. So these are the realities we're up against.
Yeah, exactly. No, I fully agree. And I mean, we're moving a bit towards the end, and I think it was a nice bridge already where you just said, I mean, what might be happening in the next 3 or 4 years. I mean, if we would be just looking ahead maybe to maybe take 2030, which is not that far away, right? What is your realistic expectation for, let's say, global health by 2030? I mean, is it more fragmented? Might we go already into a direction of further integration? I personally would say we see some signs. On the other hand, you could also see the opposite. What is your idea? How could we, or what would we potentially see in the next 3-4 years?
I think the critical thing, Stefan, is that we depoliticize health again, because it became way too political throughout the pandemic, with certain voices being very vocal, which of course I'm sure its benefits, but it's important to depoliticize it and bring it back into the framework where we say health is a pillar of economic resilience, geopolitical security, and human well-being, right? And it's not a nice to have public service, it's a must have. And we need to embed a whole of government approach again by basically having a strategic dialogue with finance ministries, by having a strategic dialogue with industry, the education ministries, employment ministries, to rethink how we drive One Health together. And if you ask me, if we manage to depoliticize it again, and we develop frameworks, new models of investment, and we show these best practices, I think by 2030, we can have a new global health architecture, although I don't like that word, but a new architecture whereby health is an integrated component in a whole of government approach. Health is not only seen as health, but linked to economic growth, new trade deals, right? And also basically in other social policy areas. I think there could be a better way forward for health, but it has to be depoliticized. That's the main thing. And also, we need for health to be basically, or for global health to re-emerge again and be integrated, we need to basically break the silos again in healthcare, so that not everyone goes and pitches for money for tuberculosis, malaria, and so forth. So how do we reestablish that again? We need to also teach our legislators a bit more in most of the parliaments across the G20 to showcase how basically rethinking health and investment into health can lift their constitutional economies as well, because they sometimes see health as black and white as well. Another thing I would say, health is not competing with security, defense, and climate change. Let's be honest, there will never be as much investment into health as it is in defense spending right now. There's no question about that. But at least upping it by a few percentages, I can't remember the actual figures right now, but that alone would change a lot. There was a figure saying you have to invest 3% in sustainable development goals out of the 1 trillion that's in equity markets right now. In sustainability bonds. And I think if you would out of that 3%, if you would invest, I think 10% of that 3% into healthcare, you could close already a lot of the SDG gaps. I can find these figures again, but that is a remarkable figure. And it shows to you, in comparison, to make it short, that you will always invest less in healthcare anyway, as opposed to other sectors. But you have to show its importance linked to the other sectors, so you don't lose out more than you do right now, especially in the last few months. And if we can manage to show this comparison and the impact that basically less healthcare finance or spending has, then I think we will get the attention of policymakers more and also create a new dialogue between industry, investors, and policymakers. But I'm staying hopeful, to answer your question, that we can, turn the tide again. But it has to be the new way in the global health architecture is talk to each other, listen to each other. Also understand that countries are looking at their self-reliance more. So it's not only about the global common good, but it can contribute through bilateral relations or through countries upping their health systems. They can help to contribute to the global health architecture as well. So we have to give emerging economies a chance. I think we have to listen to them. Africa is on the rise. They're taking much more responsibility now on their health systems. We can't just listen to the traditional actors that we did in the G7 for so many years. We have to give emerging economies also in the Gulf, Asia, the new 11. There's a framework called the N11, new 11 emerging economies. I think they have a great chance to help turn the tide and to bring health more into an integrated approach.
That sounds very good. I think I like to end with a positive tone. And so you did.
That was a long-winded, response to your short question.
Yeah, no. But I mean, I think the current environment is complex, and hence maybe the answer is also not that easy. I mean, the question sounds so simple, but of course the answer cannot be expected to be as simple as the answer was. So thank you again, I think, for all of the insights with all of the... Of course, Hatice, yeah.
I think also from coming back to our discussion in the beginning, we need a new global health leader, whether this is one country or a block of countries or regions, because regions have to take more ownership as well. So regional alliances can be more powerful in the next few years to promote health, but also looking at the appointments of new director generals, not only at the WHO, but also the UN institutions. These incoming leaders will also determine how health is foreseen in the integrated system.
Oh, yeah, absolutely. Yeah, I think that's a very important kind of further addition. Thank you, Hatice. Thank you again for all of the kind of insights, the discussions, and looking forward to what we'll see maybe in the next 3 or 4 years. Thank you, Hatice.
Lovely talking to you. Thank you so much.
Podcast with Hatice, I think, with a clear focus this time on investment and investment frames. I mean, ultimately, I think the discussion was rather on a macro level, so system level, but also beyond different countries. I think very clear when she was just explaining also the past, how maybe the frameworks, health was getting more kind of priority. It was very interesting to also see and hear that at least, let's say, some countries, I think she namely also said the leadership by Angela Merkel from Germany in 2016, 2017 was, of course, very prominent to also get health up on the agenda, on the general agenda on the G7 and the G20. I think this is, again, very much needed, but ultimately, quite clearly, what Hatice said, we need leadership to basically put it again back on the agenda. On top of that, of course, it's not only leadership, because that, from a political perspective, can only set the frames, the kind of regulatory frames, of course. But at the end of the day, we also need the various market players, including pharmaceutical industry, medtech industry, but also investors, and of course, any other partners and market participants in there. I think it's very clear as well, whenever we want, and we need to move in that direction, whenever we want to have further investment into health, and there we're speaking about different gaps in health, different infrastructures, and beyond that, we need to have that, let's say, clearly framed. She put in there the different kind of frameworks on it with the 3 items on that, but very, very clearly, what I heard as well very clearly was that it needs to be market driven, because otherwise investors would not see inside. That was an episode of MAP, the market access podcast provided by Mars Market Access and Pricing Strategy, which is your healthcare consultancy in the German-speaking markets. MAP is available every second week with a new episode, so watch out. And in case you might have questions, contact me directly and or visit our website on www.marketaccess-pricingstrategy.de.